We'll move to the next drug right here, which we'll talk about is pharmacology. And this is what is known as the evolucumab. Evolucumab. Okay. Evolocumab. So, the first thing you always notice on a drug when you are giving a drug is the most popular brand name. So, the most popular brand name for this drug is what? Repatha. All right. So, you can see that it's a fully human monoclonal antibody and it targets the proprotein, convertase, subtilisin, kexin type 9. They call it that the PCSK9. So when it targets that, it will basically lower the levels of bad cholesterols in the body. Those are the low density lipoproteins or cholesterols, and this will kind of like reduce um, your risk of having fat deposited in your blood vessels and cardiovascular disease. So when it targets this protein, um, it promotes the breakdown of low density lipoproteins. So it binds circulating PCSK9, preventing it from interacting with the receptors of low density lipoproteins. So it will now increase what the low density lipoproteins. Instead of them binding to their receptors, they'll be recycled back into the liver where they will now be broken down and be cleared. So it reduces the risk of heart attack, risk of stroke, risk of you having any surgeries done on your heart because you have some lipid abnormalities. Repatha. So pharmacokinetics is given under the skin. you know Absorption is in about 3 to 4 days. It's limited to the vascular and the interstitial compartment. There's proteolytic degradation. Elimination half-life is about 11 to 17 days. you know so therapeutic effect is just to reduce what? The low density lipoproteins. Okay, and most of the times you combine it with what? Statins, you know. So I think that's what we have for evolocumab.